Hello and welcome. In this video, we will compare FUT to FUE. What are the facts? Are there any scars? What is the cost and what is the healing process? Let's compare the two most prevalent hair restoration methods. FUT, which stands for Follicular Unit Transplantation, and FUE hair transplant, which stands for Follicular Unit Extraction. The former, FUT, is an older method that many surgeons practice. The latter, FUE, meanwhile, is the newest method available, but also requires significant dedication to master. People can feel hard-pressed to find reliable, unbiased info about hair restoration. Of course, such information is very important for deciding what procedure is right for you. At ForHair, we are always upfront and honest for one simple reason. The Cole isolation technique, CIT, is Dr. Cole's innovative FUE variant that brings truly superior results. In fact, around 40% of ForHair's patients seek Dr. Cole to repair hair transplant work from other clinics, both FUE and FUT. Even great FUT and FUE procedures, however, have their own intricacies that patients should consider.
So, let's expand on what is follicular unit transplantation, or FUT. FUT involves extracting a donor strip from a donor zone using a scalpel. The donor zone is usually an area on the sides and back of the scalp. Once the donor strip is taken, it is split into individual grafts that are often smaller than follicular units. After this, surgeons transplant individual or small groups of follicles to recipient areas. This procedure will always leave a linear scar from a few millimeters in diameter to over 5 millimeters in diameter. Unfortunately, the width of this scar is unpredictable before surgery. What is follicular unit extraction, or FUE? FUE involves harvesting a substantially larger number of follicular units than FUT from a larger donor zone, maximizing the number of available grafts. Further, the surgeon cuts each individual follicular unit one by one, and by doing so, the scars are much smaller and less noticeable. Extracted follicles are then transplanted into the bulging areas. This process can be a very long one. Sometimes, procedures split into many shorter sessions.
Comparing scars after procedure. FUE is outright the better choice for those who do not want noticeable scars. FUE scars are small and round, while FUE scars will always be long and linear. Scarring is less noticeable with FUE because scars are small, if noticeable at all, and scattered throughout the scalp. Scars from FUT are bigger and localized, making them more noticeable. In follow-up procedures from FUT, the hair is usually taken from the location, leaving a single scar. Unfortunately, multiple FUT procedures increase the probability of a wide, noticeable scar. Multiple FUT procedures also thin the donor area over time. The number of available grafts is varied from patient to patient, but there is a finite amount in both FUT and FUE. However, the total number of possible grafts from FUE is often greater, because hair does not need to be left to hide a wide scar. FUT also has a major disadvantage in that FUT can alter hair growth direction. This direction change may occur after one FUT procedure or multiple ones. FUT requires the removal of a wide area of skin, so the quality of the hair can vary on each side of the scar. Namely, hair above the scar is usually coarser than the hair on the bottom side of the scar. Changes in the hair growth direction and the contrast between fine hair to coarse hair can be quite visible with a short haircut.
How do the time and cost compare between FUE and FUT? The cost of FUE will appear much higher than FUT because most FUE variants require a lot of time. After all, FUE surgeons extract and transplant follicles graft by graft. However, the cost per hair with FUE is often lower than FUT because you can expect 0.3 to 1.0 more hairs with each graft. FUE pricing usually depends on the number of grafts needed and also on the surgeon, his equipment, the staff, and the technique. The price per graft at a quality U.S. clinic can cost between $8 to $12, whereas the latter is for no-shave FUE, or as Dr. Cole calls it, C2G. You will find a link in the description that describes the no-shave FUE technique and its advantages over standard FUE.
How is healing different between FUT and FUE? FUT leads to significant scabs and major soreness in the incision site. Healing in the first few days to a week can be rough, and it is not uncommon for FUT recipients to enlist help around the house. FUT patients must also limit physical activity for the first month to prevent complications in the incision site. FUE recovery, on the other hand, is often painless and patients rarely, if ever, require post-op assistance for day-to-day matters. There are some details patients must pay attention to, however. These include caring for donor areas, staying vertical for the first few days, and limiting physical activities during the first week of recovery. How do ARTIS and Neograft compare to CIT? Some clinics are using robotic or automated technology, namely ARTIS or Neograft, for FUE. Avoid these services. Not only costlier, clinics that offer ARTIS or Neograft often fail to produce high-quality grafts or convincing hairlines. ARTIS and Neograft are often fallbacks for surgeons that have yet to master FUE or to deliver results that patients deserve. Neograft's suction system is bad for the follicular graft's health, and the company is notorious for flying technicians with haphazard training to clinics for one-off procedures, oftentimes without any supervision from a doctor. ARTIS, meanwhile, leaves noticeable scars and charges its operators a $1 per graft royalty, significantly increasing costs. FUE, in comparison, is both more affordable and more effective. FUE offers many benefits over FUT and is especially optimal for patients who like to change their hairstyle a lot, like shorter hairstyles, have already had treatments before, need to fix FUT scars or any type of bad hair transplant, don't want a painful procedure, need a quick and easy recovery post-op.
Once had the strip method back in 2011, and it was rather gruesome and uncomfortable situation. You come out of it and it bleeds a lot and ruins your pillowcases, and I think I felt the pain from it pretty severely for about a year and a half. When my hair started to grow in and I tried to have it cut, and the touch of a comb was very uncomfortable, and that actually went on for maybe almost 3 years. And while the procedure worked somewhat, I probably would never advise anyone to ever do it, and I'm glad to see the FUE method out now. It's a lot better than the strip method.
Many patients regret choosing the cheaper option and come to ForHair to repair their bad work, leading to triple the cost to remove, replace, and create alternative donor supplies. Inexpensive become expensive. ForHair is run by Dr. Cole with 30 years of FUE hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair. We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.